little bit about extracting facials, because I've had this done, and it hurts.
Right?
Bad.
They do.
Especially around the nose, because those little blackheads that get in there.
A lot of nerve endings
That
around the
hurts.
nose. Yeah, very sensitive area.
It's painful.
Yeah,
Do you
it can be.
recommend extracting facials?
Well, if you are struggling with acne, we recommend extractions, not facials. So most dermatologists are not big fans of facials per se, because you're adding products to the skin, where on the contrary, we prefer things like microdermabrasion and extractions, where you're removing things from the skin, if that kind of makes sense.
But I feel like it's so gratifying.
Yes.
When you probably shouldn't do it at home, right? Because I've been one.
I know.
After you wash your face, you're looking in the big mirror and you're like,
Right.
oh man, just let me get a couple of these guys.
Throw away that magnifying glass for sure, the magnifying mirror for sure. We'll start new patients on a protocol of doing sometimes 1 to 4 microdermabrasions with extractions, because it can really jumpstart the whole treatment beautifully, because the topicals that we use are preventative, so they prevent future breakouts, but they really don't do much for the existing congestion in the skin. So all the pores that are clogged at present, but the microdermabrasion with extractions does that beautifully.
What clogs pores then?
So it's a good question. It's a combination of things. So acne is a combination of, we think, hormones and oil, and bacteria, we think, has a much lesser role than we used to think. There is some of it that is definitely genetic. We know that if you have a parent, 1 or 2 parents that have a history, especially people with severe acne, if you have a parent with a history of severe acne, your child is more likely to kind of struggle with more aggressive acne.